Hello, my name is Dr. Robyn Duffus.
And I'm Dr. Tammy Wong. We're presenting our poster on the diagnosis and management of urinary tract infections in infants and young children at Thunder Bay Regional Health Sciences Center between 2015 and 2018, a retrospective chart review.
Urinary tract infections, UTIs, in young children are common but difficult to diagnose. Treatment may also be nuanced and may require further testing using renal ultrasounds. To help establish standard practice, the Canadian Pediatric Society published a position statement in 2014. We aimed at studying whether the diagnosis and management of UTIs at our hospital met these guidelines.
To do so, we performed a retrospective chart review of all children aged 2 to 36 months diagnosed with UTI between 2015 to 2018, excluding children who met criteria for complicated UTIs. This was a pilot study, and therefore we randomly selected 50 of the 208 charts that met criteria. We hypothesized that a proportion of patients were not diagnosed and treated based on the published guidelines. We also identified specific clinical practice points to assess adherence to guidelines listed in the objectives section of the poster.
Our results, detailed in Figure 3, show that only 36% of children were diagnosed and only 8.2% of children were treated according to the CPS position statement. The main areas resulting in improper diagnosis included urine cultures not obtained from invasive samples or not obtained at all, and antibiotics provided prior to cultures being obtained. The main areas resulting in improper management included use of broad-spectrum antibiotics, improper duration of antibiotics, and renal ultrasounds either not being ordered when indicated or not completed within 2 weeks.
For each specific objective, we further stratified the data based on whether the patient was primarily diagnosed and managed by emergency physicians or pediatricians, detailed in Figure 4, to help us identify target topics and populations for further teaching.
The results of our study supported our initial hypothesis that there was poor uptake of clinical recommendations outlined by the CPS position statement. We were also clearly able to identify specific areas and audiences that can be targeted for improvement. Our next steps include completing the full study, then performing a prospective study after implementing teaching interventions for the medical staff.